agenda is from HHS. We have the director and her team for the Aging and Social Services Division will be presenting a workshop on Aging and Social Services. Welcome, Marilyn. Do you want to introduce your team?
Thank you. We really will try to stay time sensitive today. Thank you again for hosting a workshop that helps us highlight some of the more details across our various divisions. Today I bring you our Aging and Social Services Division, which oversees our child welfare to our senior programs. So this presentation is going to be led by Darcia Blackbeard-Lent, who is our Deputy Director, Morningstar Willis Wagner. I always just want to call her Willis, but who is our program manager overseeing our employment eligibility and senior services, and Holly DeVincent, who's our program manager over our adult and children's social services. I do want to take this opportunity. This is the team historically that gets turned to first when we are activated in a disaster to set up an evacuation point, a shelter, or even like this weekend we did a warming center. And while they didn't do the warming center part, at least two of them were very actively contacting our people from our frail and elderly community, our IHSS recipients, to make sure that issues related to oxygen access and things like that that may be impacted by the electric outage that was occurring were having their needs met and had alternatives, or looking at what the solutions were. So we are all an HHS disaster responders, and we all get out there and do what we need to, but oftentimes the sheltering ends up being a social service function. So thank you, guys.
Well, good afternoon, everybody.
Good afternoon.
I'm glad to be here. And we wanted to start off talking about the mission statement, which is empowering citizens to build self-reliant and productive communities. Aging and Social Services delivers services that help ensure the protection of children, the elderly, and dependent adults. We provide a safety net for all those vulnerable populations in Inyo County. So we definitely have our hand on the pulse of the vulnerable and the fragile and the seniors. And we also segue over into some of the behavioral health clients too. So we collaborate quite frequently with people that have persistent mental illness, dementia, people that possibly don't fit in, and there's gaps for those people. So we will definitely look to help under our Adult Protective Services program as well. So we provide food, housing, healthcare. With Morningstar, we'll talk more in a little bit about employment through education, training, job search skills, and job placement. So that's under our employment and eligibility program. So next slide, please. So let's take a look at our teams. So this first team is our protective service programs. There's approximately 20 staffers housed within these programs. Holly will be talking more in depth about the actual programs and services under this team. But as you can see, this is where the social workers live. So a very challenging and demanding job as far as adult protective services, as well as child protective services. So you can see how that's broken down into APS, which is actually encompasses adult protective services as well as other adult services. So we do LPS and in-home supportive services, which is a nice segue for those. They definitely work hand in hand with the elderly and the dependent adults and people with disabilities.
Can you define healthiness for folks?
The Lanterman-Petrus Short Act. So while that's definitely working within behavioral health and in collaboration, and our LPS conservator is Kimball Peer, who's the Deputy Director for Behavioral Health, but the actual LPS program with case management and the court system lives within our adult services program. So while we work with Kimball as our conservator, we do all the case management, we do all the court reporting, and we also handle a lot of the around the estate of people, which sometimes is very minimal. So we make sure that they have their assistance. It's a short, hopefully a short-term program for people, but Holly will talk about that as well when we get into that section. So next slide, please. This is Morningstar Shop, Public Assistance, Food Security, and Senior Services Programming. It's approximately 13 staffers within this team. And as you can see along the left, employment and eligibility, they have 10 integrated caseworkers, as well as 2 human services supervisors. This also falls under the Eastern Sierra area on Agency on Aging. Oh, I was going to do that. But this is all around the senior centers, right? So we have Bishop, Lone Pine, and Tacoma with those, and that's where the food program comes from, as well as where the long-term care ombudsman, Paulette Irwin, also lives within that program. Next slide, please. And I'm going to hand this over to Holly so she can talk a little bit more in depth about the program services. Thank you.
Good afternoon. The first program is our Adult Protective Services, also known in our alphabet soup as APS. We investigate reports of abuse and neglect for our elders that are 60 and older, as well as for dependent adults. So those are 59 and younger. We provide services to protect, prevent, and remedy abuse and neglect, including self-neglect. And APS also provides case management services to reduce the risk of abuse and neglect, to maintain and enhance quality of life, to promote self-sufficiency so our elders and dependent adults can stay in their home for as long as possible, as well as get some, continue to have their independence and respect the right to their self-determination. IHSS also goes in hand a lot with our APS. This helps pay for services for the age, blind, and or disabled individuals to promote the ability to live at home safely. Children can also receive IHSS services. It's an alternative to out-of-home care, such as a nursing home or other kind of placements, so they can, again, remain in their home, remain in their community, age with dignity. Services include personal care, bowel and bladder, bathing, grooming. It can also include household care, such as laundry, house cleaning, meal preparation, grocery shopping, and try to get them to their medical appointments. Information and referral. We field information and referral calls and in-person inquiry for both the Eastern Sierra area aging on. This is a hard one. I think it's a hard one for you too, right? So Eastern Sierra area aging agency on aging and general aging services. This also includes Mono County. So we will we help identify services that are available through the Eastern Sierra community. LPS, the Lanterman Petra Short Act, is responsible for the investigation of referrals for conservatorships of adults that may be gravely disabled due to mental illness. It is typically initiated by a psychiatrist following a hold placed pursuant to Welfare and Institution Codes 5150 and 5250. They do have different timelines that go along with them. So we initiate and oversee the court proceedings along with our county council for temporary conservatorship. If the mental illness is able to potentially get under control and they don't have to be under a temporary conservatorship, that is best, and we don't move forward. However, there are those that continue to need more support. And so it can go into a more permanent conservatorship that lasts for a year and is reviewed every year to see if it is still required. And in coordination with the LPS conservator, which is Kimball Pure, coming out of our behavioral health, we provide case management support and reassessment on an annual basis for them.
So a long-term conservatorship, you would hold that here in your department, or if it
Yeah,
doesn't
we-
get transferred somewhere, or the conservatorship?
We do that. We have the LPS conservatorships out of our office. The public guardian also does probate conservatorships or guardianships too, which definitely are more longer term than the LPS conservatorship is supposed to be. In theory, you do those, you have a hearing and you hope to stabilize the person within 12 months. That being said, we've had people on an LPS conservatorship for over 5 years at a time to try to create that safety and that stabilization for
Yeah.
somebody that really has persistent mental illness.
Okay, thank you.
So the next slide, we'll talk about Child Protective Services, CPS. We investigate reports of suspected abuse and neglect for children under the age of 18. Services are delivered in a culturally competent, family-centered, and trauma-informed manner. It provides both voluntary and involuntary services to children with their family. Involuntary includes court proceedings. It provides independent living services to youth ages 16 through 21 and hopes to help them gain some independent living skills so they can be out there living on their own, making good decisions, but, you know, learning how to get a driver's license, learning how to pay bills, just those independent living skills that we all need.
Yes.
Provide foster care services to children through the age of 21 through 18 to 21. That is through AB 12 extended foster care.
I just saw today that there was a bill introduced to extend it to 26.
Okay. It will probably be coming across my desk soon. We do have, there is a program called THP Plus that does allow for additional service between the ages of 21 to 24. And I will be looking forward to the 26. And then CPS's first priority is to keep children safely in their home. If they're unable to do so, it will be to reunify families. If children are removed out of the home, but those are our priorities, as well as concurrent planning for those children who cannot go back home to remain permanently there. The RFA, Resource Family Approval. This came about in about 2015 when the continuum of care reform came. We used to have 3 separate approval processes for homes that adoptive homes that were providing foster care, and then for homes relatives who were providing care for their relatives that came into care. RFA has actually melded all 3 processes into one. At the end of the RFA process, when the home goes through the process, they're actually in a position to be adoptive parents if they so choose to go through adoption. It provides family-friendly and child-centered approval process for both family and non-family members. And it provides ongoing support and training to RFA homes, formerly known as foster homes. And the county also puts together RFA dinners on a monthly basis. So there's ongoing training and support for the RFA homes. It's pretty successful and well attended.
This continuum of care is completely different than the other. That's so fortunate that they went out and said,
Our workers that work in APS, Child Protective Services, as well as the Resource Family Approval Program, we are in a mandated on-call response. It's for emergent needs of indigent individuals. It's a 24-hour on-call response system. It also, and this is, I don't know what year it came through, the first response, 2020, they also added the first response, which is the Families Urgent Response Team. And that is to provide emergency responses to any prior dependent child, as well as current dependent children in the whole entire county. They did not have to be a dependent child within our county. It's just if they live in our county, they do have a right to have these services to them. So the workers 24-hour on-call response, it can get very busy at times. Marilyn was just saying how we put a warning center together this weekend. Our on-call was part of that response. And the next slide, I believe, is Morningstar.
Thank you.
Good afternoon. So our programs and services that we provide are public assistance and food security and our senior services. For our employment and eligibility, we offer many different programs in our office. The first one I'll speak about is CalWorks, which provides temporary cash assistance to meet families' basic needs as well as education and employment services. We also do offer supportive services with this program, which can be childcare, mileage reimbursement, the necessary items to gain employment, which would be if there's any training needed, those types of things. And in that program, we're currently serving 51, we have 51 cases in that program, and serving 123 persons. And then for Medi-Cal, which is our bigger program that we offer services for, is we've determined eligibility for the Medi-Cal program and the California's Medicaid healthcare program, which pays for a variety of medical services. And in that program, we currently have 3,555 cases, and we serve 6,290 people, which that is our biggest program.
Yeah.
And with a lot of the new regulations that have come out in July, a lot more people were eligible to the program as well. So that gave us a pretty good increase in our cases. Our next program that we offer is the CalFresh, which is the California's Supplemental Nutrition Assistance Program, which is referred to as SNAP. Which issues monthly electronic benefits to purchase most foods, providing food security and improving nutrition for adults and children. And this is another one of our programs that is high in cases. Currently, we have 1,186 cases and serving 2,197 people. Other programs that we offer in our shop are foster care funding, which includes KinGap, adoptions payments, CAPI, which is a cash assistance program for immigrants, and our general assistance program as well. And then for our senior services, for our Eastern Sierra Area Agency on Aging, it's written right there. So, well, I did not want to mess that up. So we, like Darcia had mentioned, we do have 3 locations here in Inyo County where we have the congregate meals, but we also do offer it in Big Pine and Independence as well. And so that's in Bishop, Lone Pine, and Tacopa. And then we also do contract with Mono County, and they have their center in Walker. And so the services that are included in this program are the elder nutrition, which includes our congregate and home delivered meals, the nutrition counseling and nutrition education that we have with our registered dietitian that we currently are contracting with because it's a difficult position to fill at this point. We have senior center activities, which include chair yoga, movie day with popcorn, walking, book clubs, that type of thing. And then we do also offer services with transportation, which is our assisted transportations to doctor's appointments, to, the necessary places that seniors may need to go, and information and assistance, telephone reassurance, and legal assistance. And for transportation, we do also offer bus passes for our seniors. We have our HICAP program, which is the Medicare healthcare counseling, and they come in and will offer assistance for those that are needing assistance applying for Medicare or understanding how they need to apply. And then we also have our family caregiver services, such as caregiver assessment and respite services for those that are in need for that. Our Friendly Visitor Program, which is a Mental Health Services Act funded program in Inyo County. So it's designed to help those that are isolated, need visiting, and our seniors really enjoy that. And so it's nice when we are able to get those referrals and be able to meet that need. And then with our long-term care ombudsman, which is Paulette Irwin, she advocates for our residents in our long-term care facilities, and resolves any complaints filed by the residents, friends, or family members by advocating for the residents' wishes, and investigates reports of any abuse or neglect occurring within these facilities. And the investigation is at the direction of the resident.
Have there been any issues with regards to funding for the transportation for the ESAA? And I recall something coming through the Transportation Commission, some of the grant funding. There was issues with that. Is there any problems there, or are you guys getting what you need?
I believe
seniors?
we're getting what we need.
Okay. Okay.
Elizabeth Baker. We used to get money from the local transportation commission, but because of some audit findings and some real big regulations that they've changed, we have turned down that money.
Okay.
And we're using other funding. So we were getting about 40,000 a year, but they required an independent audit every year.
Yep.
And this is a very audited program by the state.
Yeah.
And we were doing another audit they didn't find was totally satisfactory. So we worked with the budget tein to
Find
other funding. Yeah.
Okay. That was my question. Thank you. Well, I didn't mean to have you leave. Yeah, and just the Friendly Visitor Program, super huge thanks, kudos.
It's a really great program, and I know the seniors really appreciate it. And I know in our South County, we have a new person working there, and she loves it, and it's really I think it's really benefited the community.
I think so. I hear a lot actually. So thank you.
We actually utilize the Friendly Visitor Program in adult protective services too, to assist with just putting another set of eyes on that person that might be very vulnerable and housebound or living alone, because it just helps, like with the in-home supportive service program. If you can put a care provider in the home for a few hours a week, you have a friendly visitor coming once a week for, a half hour, and sometimes they go for a ride, or it really helps keep that senior or that disabled person independent and longer in their home, right? Which can be very, very challenging.
Yes.
Especially if they live in a remote area.
Yeah. Thank you.
So this next slide is about funding streams. And this is around the funding that all of our programs currently are receiving. So they get state and federal funds, as well as 91 and 2011 realignment funds. There's also donations within certain programs, as well as fees, which are the facility use fees for the different county maintained buildings. There's general fund, which also funds ESSA, and I'm not going to even try and say it, and the general relief that we have. Next slide, please. So 2022 year in review, and this was one that Marilyn was going to. Oh, I'm sorry.
So there have been some initiatives that have changed in 2022 in adult and child protective services. So to be eligible for APS services, it was 65 and above. They have now changed it to 60 and above. So we have gained another 5 years of seniors to look after and make sure that they are okay. The definition of self-neglect has been expanded to include those people that have failed or unable to manage their finances. And we have also been able to add 2 new social workers, one to APS and another to CPS, to support the increased caseload that has come from the change of eligibility age, as well as increased workloads to, I would say, the continuum of care reform within child welfare as well. It also has allowed us to expand our capacity to provide voluntary services in APS and to ensure the ability to meet the increasing workload requirements in both systems of APS and CPS. And under the Resource Family Approval Program, the initiatives have continued to expand the number of approved homes. We've added 2 new RFA homes in 2023. In 2022, excuse me. In 2023, we have now added another 2 recently for a total of 21 additional homes with the 2. With the 4 that are additionally in the queue.
That's incredible. When I was a foster parent, you know, when we knew we took in another life.
Yes.
Like, there were not one. It was like 6 or something.
Yes, I can say our community has really stepped up for our children. We have some really great RFA families and homes out there, whether they take them on a long-term basis, a respite basis, or even helping another RFA home to provide daycare services, you know, while people work. They've really banded together.
Do we know if Mono County has a similar number now? Because back, you know, 15 years ago, they had 0 1.
I believe their numbers have increased. I don't know what their numbers are, but I believe their numbers have increased. I'm hoping that with the melded processes that it has made it a little bit easier. I could say within Inyo County, you know, the revitalized RFA dinner socials, this is really where our RFA home have been able to gain relationships with each other and check in with each other and make sure that they're okay. Obviously, you know, while the social workers in the county support the RFA homes, they also very much support each other, support the children. It's actually a really great little community, even them within themselves are having. But the RFA dinner socials, like I had said earlier, you know, it allows us to provide ongoing in-person training, as well as to let them know that they are appreciated and a place to talk and socialize with each other and staff. So it's actually been a very good year in 2022, and I think it's really starting out great in 2023 as well.
All right, so for employment and eligibility, we've just currently interviewed for an additional caseworker to be working in our South County office. They will be providing services to our jail and then also be working out of our Lone Pine office. And that's with the current initiative for the Calling Path program, where we are to be offering Medi-Cal services and checking for eligibility for Medi-Cal for persons that are incarcerated that are going to be released, to make sure that they have at least been reviewed for eligibility if they're eligible for the program. And then we've also, with the increase of the raising the asset property limit for the Medi-Cal program. We have determined eligibility for additional 1,000 more residents in our area to check for Medi-Cal eligibility due to the increase. Yeah, so it was at your property limit was 2,000 prior to July 1st. It increased to $135,000 per person. And then an additional, if they were a two-person household, it increased an additional amount per additional person in the household. So it's a huge increase. And so it made eligibility an option for many people in our community. Yes.
Wow.
And then our welfare to work classes, we have restarted those beginning in May of 2022. The state had given an exemption, a good cause exemption for all those that were receiving CalWorks. And so that blanket good cause went away effective May of 2022. So we were able to start implementing our employment classes again. And so that happens on a weekly basis. We have curriculum that we follow. And it's called the Work Keys program, which is an accredited program, and those that go through the classes actually receive certificates. And so that has been great having the community. We have a lot of people come to that, not only our welfare to work participants, but other persons in the community are able to join. And then in those classes, we go over the job readiness skills, interview skills, completing any applications, and navigating through agencies. And then for our aging services, we've identified key infrastructure projects throughout Inyo and Mono counties, including new flooring in Bishop and Lone Pine kitchens. So our Lone Pine kitchen was completed in January. Our Bishop kitchen is currently being worked on right now. So we're closed in Bishop, but still offering services to those in our community through home delivered meals.
Where are you preparing that?
In Lone Pine.
Okay.
So we had to kind of back and forth, but it's working, and the staff have done an amazing job coordinating the whole process.
Yeah.
It's a lot of meals to make. So it's busy, but they're really excited for the new flooring and a facelift on these. Both Lone Pine looks amazing, so I know Bishop will be the same.
Nice.
What's the attendance like in the congregate setting now? Have we recovered from?
Yes, it's amazing. So in Bishop, we're having upwards of 80 congregate members.
Nice.
And in Lone Pine, our numbers are up as well. They're around 30. Before it was like 15. So now it's doubled. Tacopa, where I know right now it's a busier season for them. So they're getting between 15 to 20. So it just depends, especially for them, the season. They're a little slower in the summertime, but right now they're a little bit busier.
And what do our home delivered numbers look like?
They are upwards. Gosh, I think they are sending out, I think we have 115 persons receiving home delivered meals. So, and they prepare a hot meal and then they home deliver the 4 frozens. So they are putting out a lot of meals. And I know I think at one of the portions at the end, it talks about how many meals we actually served in 2022. It was over 50,000. So pretty amazing.
Yeah. So just for the record, from some seniors, I know there's a lot of food in each home service.
Yes.
They can store it up and have it for the weekend.
Yes. Yeah, we have a lot of seniors that they say they're able to get 2 meals out of it.
They do.
So it's nice.
And we discontinued the icicle bags.
We did. Yes. Yeah, that was, yes. Yeah. So that is no longer happening. And so everyone is able to come and get a meal and not have to pay on that day. Yeah.
Once you're under 65, I thought we had to pay for them.
Yes.
Yeah. If we're ready. Yeah.
Uh,
65, you pay.
It's 60.
Oh, 60.
60.
Oh,
Yeah.
it's 60 now.
Mhm.
You said that.
Um,
So I had a quick question. So I was aware of the increase for eligibility. I didn't realize it was 135.
yes.
Who determined that? What agency?
Department of Healthcare Services.
Does?
Mhm.
Okay.
And also, I mean, they are looking at in 2024 that limit is actually going to be going away.
Okay.
So the properties, still exists. And there is a share of cost that exists because that comes from the income that the person receives. So although they may have Medi-Cal, they may have a high share of cost. And that I think that takes a little bit of an understanding for people to understand where they may be eligible because they may be under the property limit.
Yeah.
But due to their income, they may have a higher share of cost.
Okay.
So. And then with our ombudsman program, we had the robotic pet project, and that was able to be given to 14 residents in the facilities. And Paulette has one of the most amazing videos of some of the seniors receiving those, and it's really heart-wrenching.
It should be on this list.
And then the holiday cards for the nursing home residents campaign, that was also part of our 2022. Thank you.
Okay.
So what impact are our services making? So last year, there were 72 children and their families who received supportive services to keep their children safely in their home or while helping them to reunify with their family. This included helping one little boy whose parents were struggling and having difficulties and lost contact with the agency. The father was able to overcome his struggles. He got him back in touch with the agency. He worked with the social worker hand in hand. He got sober. He remains sober to this day. He is definitely in recovery. He found a job. He was able to reunify with his little boy. And he eventually took his son home with him after a court hearing. We see them often and doing well. It is very nice to see. In our adult services, we have helped 170 aged or disabled people to be able to live safely in their home as a result of receiving IHSS services. IHSS helped one longtime resident stay safely in her home for an additional 5 years as her physical health declined and her dementia worsened before receiving a higher level of care. So she was able to be, in her community around her neighbors who she absolutely loved and with her animals, that was a really big deal to her. And 14 individuals who were either aged or dependent adults were able to remain safely in their home as a result of receiving intensive voluntary case management services. One man, he did suffer some unexpected medical issues. We helped him get his Medi-Cal transfer here to Inyo County so he could receive all the services that were available to him. And he did get through that time period of establishing him here in Inyo County. He did receive home assistance, receiving services for Medi-Cal. It allowed him to stay into the home until he was able to be transferred into the facility he needed to get the help that he desperately needed.
We have 170.
I'm sorry?
We have 170 people that living in homes that IHSS. Purchased.
Absolutely.
That's amazing.
Yeah. And then with those, yeah. And then with that, you would think that, there's just as many providers out there, that are members of our community that are helping keep our other community members in their home safely. And your county really does have a great community and taking care of our own.
All right. So the impact that our services are making with our CalWorks, like I had talked about, our employment readiness classes, we were able to have several recipients that participated, and they received help with building their resumes, learning their job readiness skills, developing their interview skills, and learning the skills necessary to keep a job. We did have one new mom who participated in the classes and received the supportive services such as childcare, and they were able to find employment, and they actually remain employed today. So it's always nice you get those stories that it's like, yay.
Yeah.
And then with our long-term care, 60 long-term care residents received advocacy on their behalf through the complaint resolutions, investigations of abuse and neglect, and assistance with information and execution of advanced healthcare directives. And advocacy on behalf of one long-term resident of Inyo County ensured that the facility did not transfer the resident out of the area. And instead, our long-term care ombudsman was able to advocate for the resident to stay in our facility locally here and allow the individual to pass away near their family and in their home community. And then with Inyo and Mono County, we were able to serve 577 seniors, 467 in Inyo County. And here's our meals that we were able to put out in 2022, which is 55,443 meals, helping to ensure the nutrition and risk of isolation. And one senior who is new to the Owens Valley was struggling with depression, unsure if they should have moved to our area. They began participating in the lunch program and met other seniors and started volunteering at the center. And today, the senior has a network of friends and volunteers at the center and in the community today. And they're still here in the Owens Valley. Thank you.
Nice result.
Okay, so this is looking ahead or looking forward to 2023 and beyond. And this was one that Marilyn was going to speak on. Okay.
So thank you. I did want to note, and I think it was sort of spread throughout there, the benefit of being a health and human service agency is our ability really to cross our different disciplines and meld funding together, such as the Friendly Visitor, which is funded with behavioral health funding. So, or our FERS response, which is the on-call piece, is responded to by our aging and social services on-call system, but the day-to-day follow-up the next day during business hours is through our first team, which is housed in behavioral health. So, but we do have some initiatives and projects that we're expecting and that we've been working on and are going to continue over the next year. One is system improvement planning. In child welfare, the SIP process, because we love alphabet soup, as Holly called it. The SIP process has been in place since I think 2005. And it is a new requirement coming into called CalOR, which is a new system improvement process for our CalWorks programming. That's in the process right now for child welfare. We're at the beginning of our 5-year planning process. I believe the SEIU and the union representing IHSS workers did speak to your board during public comment recently, and that is an anticipation of bargaining being initiated by their organization within the next few months as we near the end of our contract with for the current or the MOU, excuse me. We are also in the process in the next year will be the end of our 4-year area plan for the Area Agency on Aging. And I've had more practice. And so we will start that process of doing that planning, that 4-year planning at the end of this year. where we will start with a needs assessment of services and resources throughout both Inyo and Mono counties. One of our big issues that's coming up, and we spoke about this a little bit during a department head report, is the termination of the COVID-19 waivers. This is going to be impacting our CalWorks, our CalFresh, and Medi-Cal eligibility determinations and redeterminations. So those are some big things coming up. The CalFresh allotments and emergency allotments are going away. So a lot is changing. And then in child welfare, we continue to move forward with replacing what has been historically called CWS-CMS, which is Child Welfare System Case Management System, with CARES, which I don't remember what the CARES stands for, but it's a new child welfare data system. What we will need, I think we're going to be assessing our needs, temporary or contracted resources we might need as we go forward. For example, our system improvement process in child welfare, we typically have a contract with UC Davis to help us navigate that process. And possible overtime or possible program staffing needs as we move forward. We do have some, next slide, please. We do have some ongoing challenges. You've been hearing this from me from each of these presentations. We also have recruitment and retention challenges in our aging and social services program. Currently, as Holly talked to you about child welfare and adult protective services, and I think Dorothea showed you our organizational charts. What wasn't out there is that of those child welfare workers, social workers, while we are authorized for 7, we have approximately a 40% vacancy rate. We have approximately a 33% of vacancy rate with our APS social workers. All it takes is one person leaving an APS, and that's a third of the workforce. That doesn't include our IHSS nurse position, which has remained vacant for over a year as we tried to work with Cal HR, the human resource department at the state, to approve a Inyo County specific public health nurse case manager position so that we can not only use that person for IHSS, but also for our foster care nursing and other critical protective service functions. We are impacted, but with recruiting because of our limited housing stock and the cost of living in the area. We have lost social workers and other key positions who might be interested in coming here because of an inability to find housing. I think one person who we were looking at hiring as a supervisor at one point spent over a month just trying to find some kind of a housing and finally had to just decline the position. So it is an impact. It's not our impact alone. It's the impact countywide. And then, our on-call requirement, does have an impact on, people can get burned out. And you can see where that burnout is exacerbated when we have vacancies because that reduces the number of people. The other thing that I want to say is, like with our child welfare, while we do have 4 positions, half of them have been a social worker less than a year. One just over a year. So it is a learning curve that is not an easy one. It takes an average of 2 years before social workers are really feeling pretty confident, and able to be more independent without the support of a supervisor or program manager level person. And then managing the workflow as we unwind the Medi-Cal continuous coverage and emergency CalFresh allotment associated with COVID-19. You have, again, your team is a committed team. They They work really well and partner really well to try and find creative solutions to help the people that we serve. But we still need some things that we may need to look at in the future is flexibility. Again, board advocacy at statewide associations, and whenever you have contact with policymakers, to get our voice out there for rural California, because rural California often gets seen as being able to easily implement all these wonderful ideas. So I know I get on a soapbox, so I'll shut up. And then, looking at, do we need to look at finding new and creative ways to really enhance our ability to recruit? So with that, I think we're all available for any questions you might have.
Wow.
And look at that. We did it almost within the time frame we asked.
Almost only have some pressures in here.
I know, but we like almost.
Yeah, pretty darn good. So any comments? Does anybody have questions?
I will say that in Lone Pine at the senior center, as well as the Dakota at the community center, my constituents, really rely on and end up bonding with staffs at those facilities, and they may be hired to be food prep. They end up being counselors and all kinds of things. And I think it's great to community like ours that happens. For advice and just help them. I see that. I hear about it, see it. That and to me, that's one of the bases of our county. Are those.
I'll say, ditto from what I hear from my seniors, constituents, and I do have, I have concerns and worries about our ability to recruit, especially social workers, odds and positions, since these are hard. It's hard work to do. It's emotional taxing, and then when we think about care court being added to part associated with that. And one other thing here, coming down the line, it's going to require another social worker. That there's just not enough folks to be able to focus on stuff. Any of the mobile crisis units, so it's added on-call time, on-call responsibilities. So how do we find people that don't even really exist that are trained and in order to do it, and still follow the minds. Just an ongoing challenge. So we're find a way to make our employees as happy as possible and they're here, so we don't jump ship to go somewhere else. Appreciate all.
No, they're the ones doing that.
Thank you. Any public comment? Fine. Well, I'll just say, no other comments. Yeah, thank you so much. I appreciate not only the information, the education, but obviously the service you're providing. Like Matt said, I think you're the public face of the county to many new people. And it's just appreciated. So thank you, especially with our aging folks.
Well, thank you very much. And if you guys know anyone who wants to be a social worker, having started my career in this county as a social worker, it is the most rewarding job you can ever have. And look, you too can become the director. So if you're watching,
I found one at Pine Pass one time. So
Marilyn, Anna, Narcia, Holly, Morningstar, and Melissa back there. Thank you.
Thank you.
thank you.
Guys.